Good morning, everybody. My name is Councillor Chris Moyes. I'm the chair of the 2S LGBTQ+ Advisory Committee. My pronouns are he and him, and I'm pleased to welcome all of you to our 11th meeting of the term. The clerk has confirmed that we have quorum, so I will call the meeting to order. This meeting is being held as a hybrid meeting in Committee Room 1 at City Hall, and also using the city's WebEx technology, with members and staff participating both by video conference and in person. We ask for your patience with any delays and technical issues. Members of the public are welcome to attend this meeting in person or can watch the meeting streaming live on YouTube at youtube.com/Toronto City Council Live. A few reminders. Members, please keep your videos on. If members wish to ask questions of staff or to speak, please raise your hand or unmute your mic and indicate your intention to speak, and I'll create a speakers list. When voting on an item or motion, I would also ask members to raise their hands to indicate your vote. If there is a recorded vote, you will be asked to state if you are in favor or opposed. Members, I want to remind you that you must still submit motions in writing. The clerk's staff are available at 2slgbtq@toronto.ca to help with motions. Although some of us are in different locations and meeting remotely today, the 2slgbtq+ Advisory Committee acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. May I have a motion to confirm the minutes of the 2S LGBTQ+ Advisory Committee on January 28, 2026? Vice Chair Vigapka, all those in favor? Opposed? Carried. There is one new item of business to add to the agenda. It's a letter from me on the Barbara Hall Park Revitalization project update. I'll move to add the item to the agenda. All those in favor? Opposed? Carried. Thank you. Before we begin, I would like to propose that we consider item QS 11.4, Thrive Toronto Mental Health Report Card and Toronto Public Health Action on 2S LGBTQ+ mental health as a second item of business today to ensure that the staff are available to questions from the committee. Hope that's okay. So our first item is QS 11.1, Queen's Park North Revitalization Project Update. Shannon Lawrence, a Senior Project Manager, Parks Planning and Strategic Initiatives, Parks and Recreation, is here to give a presentation to the committee. You may go ahead.
Thank you, Councillor Moyes, and thank you all members of the committee for inviting us to present the project today. I'm Shannon Lawrence, so I'm the Senior Project Manager for the city's park design team. I work on the Queen's Park North project. I'm joined by my manager, David O'Hara, as well as Joanna Delas Reyes, who is our engagement lead on the project, and we have two members of our consulting design team here, Jessica Hutchinson from Janet Rosenberg Studio and Todd Douglas as well. So we're here today to present to you our work to date, including the engagement process that the city has been leading since last summer, and to introduce the revitalization project, how we have engaged to date, what we have heard through that engagement, as well as some of the background on the donation terms and the stewardship model that's being proposed in the park. And we will present sort of how all of this has evolved, the design that has gone to council and will be going back to council in June, and as well as our next steps in the process. So the project originated in late 2024 when the city was approached by the Weston family with an offer to donate $50 million to improve the park, plus an additional stream of funding for long-term maintenance and programming within the park. And in response to that, City Council directed staff in March 2025 to advance the project. And so we had direction to advance the project along two streams of work. And the first was to undertake community engagement and preliminary design that would inform the scope of a larger donation acceptance agreement, as well as to negotiate the terms of that agreement. And so that first phase of the work is funded through an in-kind donation from the donor. And in March 2026, we took the terms of the donation as well as the engagement findings to date back to Council. Council did adopt the terms of the donation agreement, but directed staff to come back. So this was our direction in March 2026, that staff would come back to the June Infrastructure and Environment Committee and provide an update on the actual concept design with some additional inputs that would be worked on over those 6 weeks, working with other divisions within the city who have been part of the project to date, but working to deliver some specific pieces of analysis. So that included an updated urban forest management plan, a heritage statement of significance, further analysis on a cafe business case, which we'll get to in the presentation, as well as a public art plan. And we also had direction to bring back the draft terms of reference for a community advisory board. So the structure that's being proposed is that through this new stream of maintenance and programming funding, there would be a tri-party maintenance and management table that would be comprised of the city, the donor, and the University of Toronto. And alongside that, there would be a community advisory committee that would help inform decisions being made in the park. So this is the high-level project timeline that we have been on. As I said, we went back to Council in March 2026. We have then been working on those pieces of information that will further inform the concept design that's going back to Council in June. Once that's complete, we would then, and Council adopts the draft concept design, we would be moving through detailed design work, and then moving through a typical construction tender and award process and into construction. Those dates are currently being refined. They should be included in the staff report that will be live on June 3rd. So I don't have that timeline specifically updated today, but we are working to have that for the staff report back to Council. Queen's Park North is a 5.2 hectare park. It's located just north of the provincial legislature, and interestingly, it is owned by the University of Toronto and leased by the city for 999 years. So it is designated as a city park. It means that there's no specific catchment area and that it has a role within the city in terms of users due to the location, size, functionality, and access. It's also recognized in the Downtown Parks and Public Realm Plan as a potential high location for investment and, as I said, designated through the Parkland strategy. There's also a number of assets that currently exist in the park. Most notably, there's a loved tree canopy and an urban green space. It is referenced as an urban oasis through all of our engagement with community to date. There are picnic tables and benches. There is a bottle filling station and walking paths. There's a recreational perimeter path, as well as public art and a TTC entrance that was opened in 2024. Notably, there was a revitalization project that was completed in 2019 by the city, which undertook work to improve the site, and this donation would deliver some of the elements that were seen, that were identified in that project, as well as an additional layer of programming. The park has significance to the 2S LGBTQ+ community. ERA Architects is our heritage consultant on the project, and they prepared a historic context statement that has guided the work from the very beginning. And they identified sort of the park as having a significance for the queer community, particularly as the site evolved through the 1960s and 70s. It was a site of the Toronto's first Pride Week. There was a march that had concluded at the park, and it remains a park that is used today by the queer community, and it's a symbolic space in that way. So this has been at the top of our mind sort of as we began this process and through our engagement process. The project also delivers and is informed by many city policies and strategies, and we see this as an opportunity to really implement some of these strategies. The official plan, of course, aims to protect, enhance, expand, and integrate parkland, and it reinforces the need for ongoing investments in park upgrades, maintenance, and expansion. The parkland strategy identifies that Toronto is growing and that this growth needs to be managed to preserve the most valued features and elements of parks while positioning the city to maintain and enhance that system. And of course, the TO Core Planning for Downtown identified the park as having high importance both citywide and provincially. So through the parkland strategy, we really look at the impact of growth and what that means in the downtown core. It's hard to see on this map as the park is quite small on this map, but the park really sits in the middle of this part of the city that will experience a high impact of growth. And what the map is illustrating is the amount of parkland available to residents by census dissemination block. And so it identifies that areas under 12 meters squared are considered to have low parkland access and provision, and less than 4 meters are considered very low. And so the estimated impact of growth in this district means that we will see more pressure on the park, and so this revitalization project really offers an opportunity to plan for that increased use, to make sure the tree canopy is being maintained, that there are sustainability and ecological plans for the park to support that level of growth. Planning for growth also means looking at sort of many overlapping experiences and what makes a high-value park. And so we know that there are many sort of different uses and needs within Queen's Park North, and there's no one-size-fits-all approach to this planning. So in Queen's Park North, in creating a high-value park, what this means is we're really looking to balance this use of the downtown urban oasis, as well as a park that is very, very well loved and used. So we are looking to protect and enhance the park's trees and landscape, as well as carefully introducing elements that support learning, gathering, and everyday use. This project vision statement was developed and refined through the city's engagement process. So this is the final vision statement that went through the public consultation and engagement process. The vision really is for a resilient park that is achieved through many streams of revitalization work. We are looking at this enhanced maintenance program that, again, would allow the trees and the ecosystem to thrive. We're looking at how to bring additional layers of programming and education into the park. We're looking at how the visitor experience can be improved for all ages, as well as high quality and inclusive design and a collaborative governance model that would support this entire vision. There are 7 guiding principles that were also developed and refined through the city's engagement process, and they really look at how the project can progress, taking all of these factors into consideration. This is the engagement timeline that we have been working towards, and we concluded our last meetings in early April. The summary reports for all 3 phases are on the project website, so it's the Queen's Park North Revitalization, and I can point you towards the website if you haven't already had a chance to look at it, but all of the detailed summary reports, as well as the data from the city's surveys, are available there. We conducted a number of engagement activities over that time. We've spoken to more than 3,000 people in that context. We have had public meetings, focus group meetings, pop-ups in the park. We've also spoken and met with urban Indigenous communities and First Nations. Engagements and consultation are ongoing. We have also worked with what we are calling the Neighborhood Institutions Working Group. The park is surrounded by many cultural institutions, and so working as well with those neighboring institutions to understand how they use the park. And so here's a snapshot of what we heard. And overall, what we heard is that there's a range of perspectives on the park. There are folks who would, prefer no change in keeping the park as it is today. There are those that would appreciate conditional change. And then there were those who said change was great and really loved the plans that were being presented. Through our focus group meetings with the 2S LGBTQ+ community, we heard a lot of support for many of the elements that were in the draft design concept. Particularly, there was an appreciation for the balance between respite and activity that the project was trying to strike. There was also appreciation for what was called at that time the tree walk, and has advanced in thinking towards becoming a learning forest, as well as the inclusion of new washrooms and new lighting within the park. Participants expressed the importance of having presence on the emerging advisory body, and one of the few places where members of the queer community could see themselves without having to pay or use the space was something that we heard a lot, and we were very mindful of that as we went through the design engagement process. And understanding and respecting the range of park uses was something that has informed the design evolution, and something that Jessica will speak to as we talk through that. So a quick note on the donation and the key terms that were adopted by Council in March. So the donation is up to $50 million for capital revitalization. The city would oversee design and capital delivery. As I noted, there's a tri-party maintenance, operations, and funding agreement. The city would secure any required changes to the current lease with the university, and there would be donor recognition in line with city policies and typical parks donation and recognition policies. So the shared stewardship model that I mentioned as well is this new model for delivering the vision and principles in the park. It offers the opportunity for enhanced maintenance, including with the University of Toronto, the position of a dedicated executive director to bring new programming and oversight to the space, and that would be, appropriately scaled within the park. It also establishes an Indigenous leadership circle, a steering committee, and the park advisory board. So all in, we're looking at improved park assets, improved natural areas within the park, and improved supports for existing and new experience within the park. There would be more money and resources for taking care of the park as it exists today and as it's envisioned in the future. So I'll turn it over to Jessica.
Thank you, through the chair. From our design perspective, it was really important for us to apply the Queen's Park's historical context to understand the natural and cultural forces that have shaped this wonderful place that we know today. And it's long been more than a place of respite and green oasis. It's really been a place of democratic existence, a place of public expression of identity and community and ideas, a place for gathering and connection. So those were really informative to our early thoughts. But it wasn't always such a welcoming place to all. There was a history of surveillance and over-policing, which disproportionately affected the 2S LGBTQ+ community. This resulted in the loss of shrubbery, planting, gathering spaces, and amenities like the bandstand and washrooms that were once at the center of this park. And so, this really, in a way, makes subsequent community gatherings and demonstrations that much more important. So this was the backdrop to our engagement that followed. Next slide, thank you. So conversations with the public made it clear that visitors use the park in various ways at various different times of the day. The concept of nighttime use as being distinct helped us think about the park in new ways. We heard concerns about sightlines, when they were desirable, when they weren't. And this inspired some changes to our softscape and big part of the plan is introducing new areas of restoration to help the trees that are there and to grow new trees. And so through our conversations, we responded to comments to model and change where the softscape was to better support existing patterns of use in the park. So we continue to explore this balance between lawn and what we call understory planting, that restoration planting, and those continue to evolve through conversations with the public. Thank you. A particular example in the case of the largest oak in the park, we call it Tree 139. It's seen on the left here. It has special meaning to many groups. And in an early iteration of our concept, seen in the middle image, we had surrounded the tree with this new sort of delicate understory planting. And when we shared this image with the community, we heard feedback that it is often important for visitors to get up close with trees. And so finding that balance between allowing access to trees and doing restoration planting to help trees is really important. And we heard that, well, this planting would likely be damaged because people still want to access this very special tree in particular. So again, changes were made. The far right image, we've worked with ecologists now to create a mulch area around the tree that helps protect the delicate tree roots while also allowing for those uses to continue. So these were just two examples of how feedback has started to shape the park design. There's many more that we don't have time to get into today, but we so appreciate the level of engagement and commitment to making these park improvements welcoming to all. And this work continues. We also are looking at delivering an interpretation plan for the park. That helps to bring the various histories and stories to life through an interpretation strategy throughout the park. And so that's where, again, these stories, these 2S LGBTQ+ stories will start to continue to inform the project as it moves forward. And finally, just the inputs that came from the formal engagement process were wonderful. We also, the work of many writers and researchers, advocates, we just wanted to acknowledge the contribution of everyone who participated in those ways and through the focus groups and workshops. It's been wonderful in terms of design and interaction. Thank you very much.
Thank you. So basically where we are in the process is we are working through these additional layers of analysis that we are refining and will be included in staff's report back to council. We will then report the June 10th Infrastructure and Environment Committee, and we'll be attending council in the June 24th meeting. So today, what we'd love to hear from you is, are there any key perspectives that you feel are missing from what we've heard and what we've presented? Are there any priorities or considerations that we should be especially mindful of? And do you have any other feedback that you'd like the team to hear that we haven't been able to address? So thank you for your time, much appreciated.
Thank you. Great presentation. If you unplug, then I could see the members online. Wait for it to come up. Here we go. Here we go. Cooper, you're first. Go ahead.
Thank you, Chair, and thank you to the presenters for this very didactic presentation. I really enjoyed hearing the incredible work that you folks are doing through the Revitalization project. But one of the things that I noticed, the presentation highlighted the several engagement that you folks made with different members within the community and stakeholder groups, but I didn't really hear any specific mention of engagement with Black + LGBTQI+ communities. So I was just really wondering whether there was any targeted outreach or consultation with that community, and if so, how did their feedback help inform this revitalization design? So that's my question. Thank you, Chair.
Thank you for your question, and through the chair. We didn't target specific groups in terms of within the 2S LGBTQ+ community. We did target groups within the community at large and had representation from across the community. Within the survey data, we had large numbers of responses from folks who identified as 2S LGBTQ+ and people of color. So through that survey, we have a lot of data that informs our findings. And that is the way that we've been able to collect some of that data.
Okay. Do you have a follow-up question?
No, thank you for that response.
Yeah, thank you. And Pink Angel, go ahead. And then, go ahead, Pink Angel.
Thank you, Chair. Thank you to the presenters and the design team for this excellent work that you're doing. My question is, and I've presented this in previous Parks and Recreation meetings, that the city adopt a policy of planting shrubbery that is indigenous to this area. For example, in Minising, they found grasses that have not grown for 100 years. So maybe we can adopt that policy of planting indigenous shrubbery to attract pollinator varieties and birds and bees and butterflies, and including native varieties of trees. And a small plaque to explain what has been planted and why? And also to consult with the Indigenous Committee about every park in Toronto and Indigenous place names of these parks, because I don't think every park in Toronto has an Indigenous place name. And I think that would be a valid addition to the place name of every park in Toronto, so as to overcome the erasure of Indigenous place names through the legacy of colonialism. So those are my two suggestions. And I also have a question, is in Queen's Park particularly, what is the policy now in place to implement Indigenous sculptures and commemorations of Indigenous individuals who have contributed to the city of Toronto? Thank you.
Thank you for the question, and a lot there, so I'll try to go through it all. I will say there's a very robust program and part of the park design evolution that the team at Janet Rosenberg and Studio has worked on with Trophic Design, which is an Indigenous landscape architecture practice. So they are one of our consultants on the project, and unfortunately, given the time of this update, we don't have time to walk through the entire park design, but there is a layer of the design that is grounded in Indigenous placekeeping, both at the design level as well as at the interpretive level. We've also been able to work to develop scopes of work for the three nations, Mississaugas of the Credit, Six Nations, and Wendake, to actually develop historical context statements that would be layered into the interpretive program of the park. So I appreciate that it's not coming through in this presentation, but there's quite a lot of work that has been done. And on your first point around planting, that's been a huge part of the regeneration and restoration zone planting. So part of that ecology that's being brought into the park is looking at native species and how to enhance that native species. There's also two protected butternut trees within the park, which hold a very sort of special ecological place within Indigenous placekeeping, and some of the companion plantings that will go alongside that. So happy to talk about this for ages, but recognize that we don't have all the time today. But if there's anything Jessica would like to add from JRS.
Yes, I would love to go on about all the varieties of plants that we're bringing to this park, but just to touch on two, I spoke of the restoration areas around the trees, again, to help those trees, and that is what we call a white oak restoration reference system. So working with ecologists, that is sort of the planting palette that you'll see there. There is another part of the project, which is a smaller area called the Learning Forest, and that has more Carolinian species, and we're working closely with Indigenous groups and our Indigenous advisors on what those specific plants are and the meaning that they have, and there'll be sort of an element that helps to explain that to visitors to the park. So great questions, and yeah, definitely a big part of the project. Thank you.
Thank you. Next up is Susan.
Hi, excuse me. I think the speaker's on. I'm Susan Gapka. I'm a community member. I use she, her pronouns, elle français. Glad to see the presentation today. I attended one of the community sessions, and unfortunately, the last couple have been sometimes double, triple booked, but I think many of us could relate to that. But that was at a time there was couple points. I wanted to talk about the Indigenous ways of knowing piece and how some more publicity, or not but more visual seeing that in the presentation would be very helpful. I think thanks to Pink Angel, some of those questions have been responded to. I'm thinking of the first Gay Pride there and the work by Marcus McCain, and wondering like what you're thinking of that, how that's represented, and I'm wondering why we don't see more of that, because there's a great deal of work. Prior to my appointment to this committee, there was a presentation from the work on the Toronto Island Master Plan and Hanlon's Point. So it almost seems like there should be, I mean, there's been several times, I mean, the Cyndi Lauper concert was on the Queen's Park North, the September counter protest to hands off our trans kids occurred there. I don't know if I should mention there's been some repercussions, and there may be a lawsuit or two coming out of that for me just trying to defend trans kids, or some of us try, not just me, but I'm one of the people noted. But how we do that, and then I guess I just realized 5 minutes total, so let me, and the last point I'm remembering when there was, at Pride, there was a Take Back the Dyke. I don't know if there was an alternate Dyke March which ended on the south lawn of Queen's Park. So there was concern at the, this is kind of a private-public partnership. The Westons are not beloved by some of us in low-income categories and trying to do grocery shopping. And so I'm wondering how those conversations, the balancing, this philanthropic donation with the needs of residents and community members. Sorry for going on, but thank you for being here.
Nice to see you again, and thank you for your question, and very well appreciated. In terms of the first part of your question, representation and storytelling, that will be a layer that's developed. We are at the concept design stage, so the concept will be going to council in June with some of this high-level framework, and the next step following council's adoption of the concept would be to further develop some of these layers, including the interpretive storytelling, heritage, Indigenous placekeeping elements that are not about the physical design, but about how we experience and interpret the space. So very much appreciate that comment. As I noted, there's also a public art plan that will be going back to council as part of the June report. It will be high level, so it will identify the vision and framework, and then that plan will be continued to be worked on. So lots of space to include these stories, and appreciate you noting them for us, and we'll continue to engage on how we can best include these through some of those plans. In terms of the donation, one of the I guess exciting elements about the way that the tri-party agreement is envisioned is that it would bring an executive director onto the site. That executive director would also have a programming budget to bring new services and programs into the park. So still to be defined what that would actually look like, but I think what's exciting is that there is actually a stream of funding to address some of what you're speaking about and to bring a new layer of programming into the space.
Thank you. Any other? Here we go. Ranjit, go ahead, and then Maisha. Go ahead.
Thank you. A quick question. During your consultation process, does the change of name from Queen's Park to an Indigenous name came up? I'm asking this because revitalization for Indigenous peoples is also Indigenous erasure, and you have done some consultations. However, it is still Queen's Park. So it's this suggests the how settler colonialism spreads all over the insidious nature of settler colonialism. My question is again, changing the name as part of revitalization, did it come up? And if it come up, how are you acting on it? Thank you.
Did you want to speak? Thank you for your question, and through the chair. The question of renaming the park to an Indigenous name didn't come up through the engagement specifically. Having said that, one of the sort of biggest moves that's proposed in the concept is the relocation of the King Edward statue from the center of the park to the periphery. So the statue movement is intended to do quite a few things. One is to address the landscape and the colonial landscape that you've just talked about in the park. Another would be to open up the center of the park for civic democratic space. The park was known as the People's Park originally, so there is this idea of bringing that narrative back to the site. The question around the statue being moved and counter monuments sort of did come up, and it's something we'll continue to explore through our conversations with the nations and urban Indigenous stakeholders. So not specifically on the name, but there are other ways that this conversation has come up through the engagement. Dave, if you want to add
I think the only thing I'd add is we're talking about conceptual design now, and there's a lot more work to do, not only on the design and the implementation of the scheme, but with a team and with all partners taking a look at the park and moving forward on programming and all these things we're discussing, including working eventually towards the broader university park scheme that is approved as part of TO Core. So there's much more discussion to have for sure.
Okay, thank you. Aisha, go ahead.
Thank you. I think a lot of important considerations were already mentioned to the presentation, but there were just a few things that came up for me that I just wanted to speak to. Two voices particularly, I think, that are really important to make sure are maintained throughout the rest of the planning and implementation process are neurodivergent voices. I think often I find in a lot of planning and design for things, neurodivergent voices aren't really considered in terms of like sensory and also just, overall design plan. So I'm not sure if you can speak to whether or not you feel like there's already been an identifiable presence for neurodivergent folks. But I think for me, like through a lot of the work that I've been increasingly doing as a neurodivergent person as well, I found that there's a big lack of representation in how spaces are created, and often it ends up being that a lot of folks can't actually access a lot of upgraded spaces because a lot of neurodivergent voices and the variety of them that exist weren't really considered. So that would be one thing I would note. I think it's really great that there's already been such an important presence of Indigenous leadership throughout this plan. So just really echoing and voicing support for maintaining that through the entire continuation of the process. When it comes to things like washrooms, about like maintaining or creating them, I really want to voice support for having options for gender neutral or universal washrooms. I recently visited, just to voice like a design that I really like, I recently visited the, like a food hall somewhere at King and Adelaide, and I was surprised when I went into the washroom space that it was just a fully open, universal, gender neutral washroom. I really liked the design. People were just kind of able to flow in and out really easily. And I think it just made it more accessible to me and other folks that I was with. I know that's also a large issue that keeps people away from spaces, is knowing that those washroom options aren't available. Maintaining clean and working bottle stations. I went to a park recently where a lot of new ones were advertised. I went to all of the bottle stations. None of them were working, which was devastating. So I know that seems like a small thing, but if it's being advertised, just really having a way to check and make sure those things in the park are actually working and up to date and up to standard. The other thing I thought of was having seating options in the park. Like if you're thinking of making new ones that are actually accessible and also plentiful, that's another issue. There's not a lot of places to actually sit in a lot of public spaces. And I hear that as a big need from community members, just having more seating options. Accessible seating options, a lot of standard, I think, park benches that have the handle in the middle are not accessible to folks of different sizes. So I really want to voice support for having seats that a lot of variety of people can actually sit in. I really appreciate like the, mention of respect for existing ecosystems there and wildlife protection. So also really want to voice support for that, and doing as minimal damage as possible in the restoration and revitalization of the park. And then I think the last thing is, having good lighting and eco-friendly lighting. I know lighting is, I feel like is really important in a park, but you also want to make sure it doesn't disturb the existing ecosystem. So yeah, I also had a question. I'm wondering if there's time, if you can speak more to the engagement process in terms of like how you did outreach to get the folks to, who attended to actually attend. Thank you.
Thank you for your comments and your question. Through the chair, I'll try to go through them. In terms of the representation, I appreciate the comment and thank you for raising it. It did come up through our most recent sort of internal city review, and some really good points were raised, but I appreciate you bringing it to this forum and on the record there. The washrooms would be gender neutral in terms of how they're being thought of to date. And well noted on the bottle filling stations. I think one of, again, the exciting aspects of this project is that it brings this new management maintenance model into the park, as well as I said, that executive director role that would have more of a regular presence on the site. So I think that's a really exciting opportunity through this project. The lighting, there is a lighting strategy being developed. So we've heard also through our engagements that needs to consider the animals in the park as well. In terms of how folks were engaged and how engagement was sort of advertised, we worked with Third Party Public, which is an engagement firm that specializes in public consultation. And there was advertisements that went out over social media. There were flyers, emails, a listserv was developed through the city's website, and there was also targeted outreach to specific groups that were coming up through the engagement process as having sort of specific interests and focus within the park.
Okay, thank you. Seeing no other questions, I will ask two myself. So what landmark or symbols, wayfinding, plaques that may be put in place reflect the history of the 2S LGBTQ community in the park? And because I haven't heard anything about that. And my second question is, we know that, again, there's a lot of activities taking place in the park. Again, queer activity, history. I know that I've attended for other events like Rasta Fest, and, I think there's Jerk Fest that was there at one point. Is there going to be a space for continued activity like that?
Let me just start. I can start with the first one. Shannon mentioned an interpretive strategy or an interpretive plan. We know that the park is layered with such an interesting history, and we're just at the conceptual design stage, but this too is where we've got an opportunity to do more to tell those stories, both within the park. You mentioned signs and plaques, and of certainly other ways of interpreting the site, whether it is the history of the site as it relates to some of the events or even the tree tour, the forestry tour. So I think there's a lot of opportunity to work on all of that as we move forward. And again, with a team, with an executive director on board focused on programming and everything else, that's something that we will be able to do. And the second part, and I'll let others chime in as well. We've heard a lot about the programming that's happened in the past in the larger events and the impact on the trees. Actually, that's one of the reasons why the 2017-2019 work was so heavily focused on the impact of the trees. So what we're trying to do is make sure that there's space in the heart of the park by moving the colonial King Edward statue out so that we can accommodate more people in the middle of the park on the paved surface without negatively impacting the trees. Some of the larger events that have happened in the past probably aren't appropriate for the park anymore, but we can certainly work on a calendar of appropriately scaled events that might land in the park, knowing that the place also does need downtime for people to be able to experience it as the oasis that it is as well. I wonder if you want to add to that.
No, I would only add, in addition to what Dave said, there is a an aspect of the plan that currently envisions what is called a community workshop. More work to be done on that concept, but it will be part of the concept. It was part of the original concept and will continue to be part of the concept that staff would like to explore. It offers a space, for programming, intentional programming within the park. So that's an element we'll continue to explore. There was also proposed a small performance stage that would allow, as Dave said, appropriately scaled programming, but trying to balance that tree protection as well as active use. And so opening up that hardscape in the center offers the best way to do that.
Okay, just one final question. In the early days of this project, I heard that some trees may be removed. Is that accurate, or is that?
I don't know that we ever put forward a tree removal plan. I know there was a process that the team was exploring early on that was looking at a technique that's called veteranization, which looks at how to remove invasive species but continue to have those species, offer important ecological aspects to the park, including habitat. So that was certainly one thing that was explored. As we're at the conceptual level, we are working through that sort of tree impact analysis, and that's part of the work that we've especially been doing since we were at council in March. So that analysis has added an extra layer, including the retention of an independent forest consultant to advise economic, climate, and forestry on how the plan impacts trees. So we don't have at this moment a specific tree removal plan as we're at that conceptual stage, but we are looking quite closely at what the tree impacts will be through the proposed design.
Okay, thank you. Those are my questions. Seeing no other questions, any speakers on the item? No speakers? Okay, I'll just say thank you to the team for all the hard work and coming here today. I look forward to seeing the final report at IEC in June. I'll keep my eye out on it. So thank you very much. I will.
Thank you.
I will ask Pink Angel to move this item to receipt. All those in favor? Opposed? Carried. Thank you. The next item is QS 11.4, Thrive Toronto Mental Health Report Card and Toronto Public Health Action on 2S LGBTQ plus mental health. We have with us Dr. Michelle Murdy, the Medical Officer of Health of Toronto, and Dr. Kwame McKenzie, Chief Executive Officer of the Wellesley Institute, here to give a presentation to the committee. Welcome. I must say I've seen this presentation just last week, so times two for me. Go ahead. Green.
Green means what you say. That's why you ask. So, hi, yes. Thank you very much, and thanks very much for the opportunity and the invitation. That is not the first line. And the invitation to present here. My name is Dr. Kwame McKenzie. My pronouns are he, him. I'm CEO of Wellesley Institute, and I'm presenting today for a partnership called Thrive, and I'm presenting about mental health in decline, which is Toronto's first report card. Next slide, please. Just a bit of background, next slide, about the Thrive partnership. The Thrive table is a partnership table including Wellesley Institute, CAMH, CMHA Toronto, Family Service Toronto, Strides, which is the lead agency for child mental health, Ontario Health, and then some third sector organisations, United Way and the YMCA GTA, and city representation is from Social Development and also Toronto Public Health. And this partnership came together, next slide, in order to try and do something about the perceived mental health crisis that there was in 2016, 17, 2018. And one of the first things that the Thrive Partnership did was produce a mental health plan for the city. And there are 5 key actions. One was the creation of a learning centre. The other was the support for workplace mental health, improving access to housing, thinking about climate change and mental health. And then the top one was a community mental health report card, and that's what I'm talking about today. Next, please. Now, the aims of the report card were to assess the state of mental health in Toronto, to identify trajectories and inequities, and to be action-orientated. So it was really to produce a consensus of how you measure mental health so that you can identify who's effective, what the trajectories are, and also so it can be a monitoring a way of monitoring mental health, and we can see the trajectories of mental health over time. Next slide, please. And the way we've been doing this is through a descriptive analysis of existing data. And because we're interested in mental health, as opposed to just mental illness, we're focusing on good mental health, and we're measuring that as responses saying that people's mental health is excellent or very good. And we were analysing the data either at the City of Toronto level, or if that wasn't available because there was too insufficient data, at the Toronto Census Metropolitan level. Next slide, please. So 4 key findings, and we'll go quick. Next. The first is that mental health of Torontonians is getting worse. Next slide. Pretty disturbing that we've had a decrease from 73% of people with good mental health in 2015 down to 52% of people with good mental health in 2022. And so there's been a 21% decrease in the people who are saying they have good mental health. Next slide, please. The next big key finding was not everyone is equally affected. And specifically here, we're not going to go through all the results because it's too big, but next slide. We found that equity-deserving communities perceive and experience their health and well-being as strikingly different. Interestingly, I was at a presentation recently where they stopped using equity deserving and they started using the term equity owed populations, which is an interesting twist on it. Next slide. Fewer people identifying as 2S LGBTQ reported good mental health, and the figure there, next slide, was 36% of adults, and if you carry on, 19%, next slide please, 19% of children and youth. So if you're thinking the general population, it's gone down from 73% to 52%. In the 2S LGBT population, adults, 36% with good mental health, and children and youth, only 19% with good mental health. These results really shocked us. Next slide, please. Now, there are many reasons, and we were trying to search for the reasons in the data. Next slide. And the top issues were working conditions. So you can imagine difficult working conditions, poor jobs, 0-hour contracts, no time off. Financial difficulties. So financial insecurity is exquisitely linked to poor mental health. And then time pressures, not enough time to do what you need to do, not enough time to connect to community, were all issues. There were other things, such as perceived discrimination, food insecurity, life stresses, all of which would added to this. One of the things that jumped out to us in, next slide please, in children was that 46% of children and youth felt depressed and anxious about the future because of climate change. So you can see that there are different issues in children and youth, but obviously children and youth are living often in families And so those work stresses, the financial stresses of adults will be transmitted to children and youth as well. Next slide, please. And then we found that services are meeting the needs. So for people who got services, over 75% of people said they were meeting their needs. But often people weren't getting services, and particularly support services, housing and other support services for mental health were under stress, with a doubling of the wait times just between 2021 and 2023 of people needing community mental health services and supports for, that go along with community mental health services that are going to increase their chance of recovery. Next slide, please. So there were 4 key recommendations. The first recommendation was to work with and target strategies and supports for populations most impacted. The next was that we would strengthen social support networks and connections to communities. So there are services that you can do, but there's also an opportunity to build resilience. And one of the things that did come out of the data that linked to the fact that people had less time is that people were not able to give or receive the community supports they need to stay psychologically well. Next slide, please. To promote high-quality, thriving work environments, and last, to increase access to mental health promoting services across the continuum. So those were the recommendations. The main recommendation from the work was that we've got to do something. Mental health in Toronto is in decline, and it is time for action. So this is just the QR code for the report. If you didn't get it, if we didn't send it to you, you can pick out your phones and scan it, and if not, then it's www.thriveto.ca. And that's the end of that presentation, so thank you very much.
Thank you.
Thank you, Dr. McKenzie, and thank you to the Community Advisory Committee for inviting us to present today. Toronto Public Health is pleased to be a partner of Thrive as part of that report card, and being able to share with you today some of the work that we are doing to advance health for 2S LGBTQ+ mental health and well-being. As we've just heard, we've seen that many factors impact mental health and well-being, many of them being systemic and social determinants of health related to access, as well as experiences of stigma and discrimination. I think it makes it clear from this report card that we have more work to do in terms of supporting mental health and the well-being of 2S LGBTQ+ communities. So I'll start by grounding our work in terms of the public health mandate of being to promote and protect the health and well-being, reduce inequities across the city, and envisioning a city where all people can be healthy and thrive. Our work is guided by the Ontario Public Health Standards and include related to those mental health promotion, substance use, and health equity. It's also shaped by their strategic priorities for 2024 to 2028, including promoting positive mental health and reducing substance use harms. At a city level, our work aligns with the Our Health, Our City, Toronto's mental health, substance use, harm reduction, and treatment strategy, which guides coordinated action across prevention, care, and system planning. Our Health, Our City includes specific actions to support programming for 2S LGBTQ+ communities, particularly around mental health, substance use, and harm reduction for newcomers, as well as people living with or at risk of HIV, and those who party and play and or use crystal meth. Toronto Public Health does not work alone. We work across sectors, alongside community partners, and tables like Thrive Toronto to support coordinated and upstream approaches. With that foundation, I'll speak more specifically about how we support mental health in 2S LGBTQ+ communities. Our roles have been around prevention promotion, partnership, data and evidence, and policy and systems change. First, prevention and promotion. Much of our work focuses on strengthening preventive factors like belonging, connection, and supportive environments that we heard through the Thrive Report Card as being so integral to supporting well-being across the life course. In community partnerships and access, we work with 2S organizations to improve access and strengthen the referral pathways for individuals across our complicated mental health care system. We've also participated in the Ontario HIV Treatment Network think tank with Gay Men's Sexual Health Alliance, focused on crystal meth use in 2S communities, helping to identify opportunities for prevention, harm reduction, treatment, and mental health supports. Thirdly, data and evidence are needed to better understand the inequities and guide actions. We've seen some of the data that's available in terms of differences in mental health through the Thrive Report Card. However, we know there are many areas where we do not have that level of data to be able to describe more fully inequities that may be existing. We continue to work and acknowledge that through the city's access plan for two-spirit, trans, and non-binary youth, there are identifying data gaps as a key challenge and calling on city divisions, including Toronto Public Health, to strengthen identity-based data practices and accountability. Advised by the City of Toronto's Data for Equity guidelines, Toronto Public Health is prioritizing improved sociodemographic data collection and working to responsibly use and share this information where it exists, alongside community-informed and qualitative evidence. In our fourth area of policy and system change, we work with partners to advance upstream solutions related to housing, homelessness, crisis response, substance use, and harm reduction. Across all of this, the focus is on reducing barriers to care and improving access to care and supports. What else does this look like in practice? A few of the programs, all of our programs are intentionally designed to be inclusive, accessible, and responsive to diverse identities and experiences, including those of the 2S communities. Firstly, in terms of inclusive services and programming, this includes services like our sexual health clinics, as well as chest and breastfeeding clinics, where care is delivered using inclusive, non-stigmatizing approaches that recognize diverse identities, family structures, and lived experiences. As we saw in the Thrive Report Card, child and youth mental health of 2S communities is particularly impacted. Much of our work is focused in schools and with school boards to build resilience, reduce stigma, and support inclusive environments. We use the Healthy Schools Toolkit to support schools in assessing belonging and inclusion, as well as the Healthy Relationships Plus program that focuses on healthy peer relationships, emotional skills, and positive connections. In community-based harm reduction, we work with more than 60 agencies across 100 locations in the city to provide harm reduction supplies and services, including organizations that specifically serve 2S communities, such as Two-Spirited People of the First Nations, the 519, and Black Cap. Finally, in capacity building, we are providing training, education, and support to organizations across mental health, housing, and social services, so services are better equipped to respond to 2S communities. A couple of more examples in terms of the outreach that we have done of how this looks like in practice. During the 2022 Mpox outbreaks, we saw how quickly stigma and discrimination can emerge, and the very real impact this can have on mental health and well-being, particularly for the 2S communities. This can lead to barriers to care, reduce service uptake, and ultimately worsen health outcomes. In response, we worked closely with community partners to deliver targeted anti-stigma communications and to provide low-barrier vaccination clinics so people could access care in ways that were safe, inclusive, and affirming. We also prioritize direct engagement through community outreach, including at Pride. And this past year, we connected with tens of thousands of residents, sharing information, providing supplies, and linking people to services. Importantly, this work helps build trust and strengthens our relationship with communities, improving our ability to respond to current and emerging public health needs. Another important part of our work is the partnerships with Indigenous and Two-Spirit communities. The Indigenous Wellness Committee, established in April of 2024, is an Indigenous-led advisory body that guides the development of the Indigenous Wellness Action Plan, with a focus on improving mental health and substance use supports for Toronto's urban Indigenous communities. We support the Indigenous Harm Reduction Circle in collaboration with Indigenous service partners to strengthen Indigenous-led harm reduction services and support knowledge sharing across frontline organizations. Two-Spirited People of the First Nations is an active member of both the Indigenous Wellness Committee and the Harm Reduction Circle, and helps ensure the voices, needs, and experiences of Two-Spirit and Indigenous 2S LGBTQ+ communities are reflected in this work. In addition, we launched the Indigenous Cultural Safety Action Plan in 2023 to embed Indigenous cultural safety across our programs, services, and policy development. I'd like to end by opening up for discussion, firstly around the Thrive report and the presentation from Dr. McKenzie, and particularly to understand from you if there are any aspects to hear more from you about what stands out in that report, as well as your perspectives on terms of building stronger connections with Toronto Public Health and their programs and services to support this work as well. Thank you so much.
Thank you. Great presentation. Questions from members? Just waiting for my screen to come up. Okay, Ranjit, go ahead. Ranjit? You're still muted, Ranjit. Okay, in the meantime, anyone else wants to ask questions? Pink Angel, go ahead.
Thank you, Chair. Thank you, Dr. McKenzie, for the presentation and your team. I'm not shocked that the rainbow community is very much underrepresented in the mental health care landscape. And I appreciate that you're inclusive, particularly of the Two-Spirit and trans community. I also would like to thank you for mentioning the 519 in particular. I am part of the Mental Health Care Commission implementation team at the 519. We're past our 9th meeting, and we have 3 more left, and we're going to involve stakeholders in the 12th meeting to present their view of the mental health care toolkit that we're putting together. And I was wondering, Dr. McKenzie, if there could be some collaboration between the 519 mental health care program that we're trying to implement and your organization, so as to share learning and support and care for those who actually need it. And we're a peer support group. So our funding is very minimal from the federal government. It's only $10,000. And as you all know, $10,000 will not go very far in supporting any level of mental health care support and their journey to recovery. So my question is, in what ways can we collaborate with the 519 mental health care implementation team going forward? Thank you.
Well, thank you very much for the question. And I think the main conundrum here is that when you listen to the presentation of Toronto Public Health or a presentation from Strides or a presentation from Ontario Health, there's quite a lot going on. And I've just found out from you that there's also work at 519 and there'll be work at Sherborne and there'll be work at the CHCs. There's a lot going on. But despite that, we're seeing deteriorating mental health and longer waits for service. So the question that we're trying to think about is very much, as you say, how do we actually put this all together to stop the rot and change the trajectory? And is it that we need more of what we're already doing, or do we need to be doing some different things? And so it's sort of, we don't want to stop what's happening, but we sort of do all need to get together and say, what do we need to do that's new to change the trajectory? And 100% we need partners like 519 to come together with Thrive, Toronto Public Health and others to really be saying, what does the 2S LGBTQ plus mental health strategy for Toronto look like that is going to change the direction that we're on? And so you will get a call from us, 100%. Yeah.
Thank you. Susan?
Susan, hi.
Yes, I'm Susan Gapka, she, her pronouns. Nice to see you here. So I'm just learned a lesson in the first agenda item. This is for questions. So, but I will try to use the 5 minutes so we can get through the agenda. I was struck by the housing component and my own experience as a previous homeless person who is now coming close to almost 3 decades of being off the streets and having access to services. And so I want to talk about that in the housing part of the program. But curious in my experience around mental health and addictions and housing and services is for trans and gender diverse people, that's, I think if we had housing. So what we're finding in settings, I'm going back a few decades, but like where segregated women in this particular facility and men in that. And so where do trans and gender diverse people fit in? What are you finding out in your report card? I'm going to stop there. That's the question. So I'm wondering how, I know we're moving forward, but I'm also worried about us going backwards. So what came up in the research on that?
I think from our research, Susan, we didn't have very good detailed data on the trans populations and trans communities. This is one of the problems that we have when we are using existing data streams to try to understand in depth what's happening in Toronto. And I'm sure some of the work going forward has to be to connect with trans communities and find out more, because the worst thing we could do is to try and build a one-size-fits-all solution that doesn't work for groups that are most affected and most at risk. So I think there's more work to be done on the with the trans community to try and work out what are real and relevant solutions.
If I could add, I think your next item on homelessness does provide better data in terms of what we're seeing from the street needs assessment, looking at the gender diverse populations. But we've recently been asked to Toronto Public Health in terms of our deaths amongst homelessness individuals. We only still provide the data by males and females. We're not yet at a point where we're able to provide that data by trans, which is, partly because of small numbers, which is good. We obviously, can't release very small numbers in that part, but also that the quality of that data is not improved. So that's definitely something we are looking at to be able to work with our coroner's office to have better information, because obviously bringing to bear the worst outcomes like death is in that population is something we'd like to be able to do.
Sure, go ahead.
One quick supplementary, like my challenge when was very segregated. One time, we need to do better, I think, on some of this. And so I'm welcoming the opportunity to move that forward. I think you'll find pockets in places where, but the data, so is this secondary data?
Yeah,
so that's possibly why And secondary data, for those who don't know, is like you're looking at existing research. So perhaps in the next phase, you'd be able to look at finding what people are experiencing. And I can't stress enough, I guess I'm going to use the extra 50 seconds. My own experience, rents are so high. It's almost 20 years ago. I lost my housing because I couldn't get into a single unit place because of the high cost of rent in Toronto. And it's increased substantially since then. And that didn't help my mental health. I'll just leave it there because we're close to time. It could have gone really, really badly, but luckily I had supports in place. Thank you.
Okay, thank you. Go ahead, Ranjit.
Yeah, my question is about LGBTQ plus refugees and newcomers and their mental health, especially in the context of funding cuts introduced by the Bill C-12, the Strengthening Canada's Immigration System and Borders Act. LGBTQ plus refugees, as Dr. McKenzie, thank you for reminding that the phrase equity-oved populations, they are within the top priority group of equity-oved population. And because of these funding cuts, so many things have been happening. And some of my colleagues who have worked in the field of refugee mental health, counseling therapy, psychotherapy, are now looking for other jobs because of these funding cuts. This is how it impacts, quite apart from housing and other things. How is this captured, or is this captured in your reports, or are there any plans to capture these and highlight these invisibilized populations and their mental health? Peter, thank you.
Excellent. It's an important point that when you look at intersectional issues that are going to increase your chance of poor mental health, being from a refugee population, as well as being 2S LGBTQ, as well as having any pre-existing issues, then your chance of good mental health deteriorates significantly. And as supports and services are pulled away, then the chance of recovery again decreases as well. So I do think there are some issues, significant issues. One of the other issues that we'd probably need to think about, especially with refugee populations, is it's not only the services that are being taken away, but it is the increased stigmatization of refugee populations. It is interesting that when people think of refugee populations, they often think that their mental health is linked to trauma before they come to Canada. But the evidence shows that it's what happens once you get to Canada that it is a much better predictor of whether you develop a mental health problem or not. Being denied access to work is one of the better predictors of mental health problems in refugee populations, and the reception of the host population and the stigmatization and difficulties in moving through the refugee process are again much higher predictors of developing mental health problems than pre-migration trauma. So there's actually a lot we can do at a lot of different levels to decrease the risks of mental health problems in refugee populations, on top of trying to develop adequate services. And once you layer in on top of that 2S LGBTQ population status, you can think of a whole host of things that are possible to do that could significantly change the rates of mental health issues in refugee populations. And I would hope that when we rerun the report card in 2 or 3 years' time, that we're able to say that between the policy and service sector, that we've done something about it, because there is no good reason why refugees coming to Canada should have worse mental health, and there is no acceptable reason why 2S LGBTQ plus refugees should have worse mental health than other refugees.
Thank you. Terrence, go ahead, 5 minutes.
Thank you, folks, and thanks for the press. Definitely one of my passions and interests, working with youth, especially in North Etobicoke, Rexdale communities through the past, 12 years. So I had a few thoughts and questions that, again, appreciate that equity owed. As you imagine, working in North Etobicoke, work with a lot of folks who have those intersecting identities and experiences where it's like, yeah, we need to step it up. So chiming off of the refugee payment, what's happening with the new bill and what's shifted is it's what's called copay in regards to mental health services. So now there was already limited services, but now folks have to pay 30% of the services for mental health services that they receive, which is the copay, which folks can't afford. And so now service providers are trying to figure out as well. And this is in the private. Public is a whole other thing too, because you got public with not-for-profits, but do they do pro bono or whatever? So I recommend, as you're looking into continuing this work and doing more current up-to-date studies and what's going on, if you're looking to connect with service providers, Bluebird is actually disseminating the federal funding to the service providers in regards to providing mental health services to refugee claimants. And then I had a question in regards to what you have collected and presented so far. Has there been any geographical mapping in regards to services and what is available in regards to our community, like the GTA or Toronto? So that was the question I had, because working the burbs, as mentioned, there's a lot of gaps. And if there even is any targeted services, which rarely are in some of the areas, even if you don't have targeted services, the services that do exist are not inclusive themselves, and that can definitely contribute to some of those mental health pieces. So wondering in regards to the geographical pieces, what we can do in regards to that, as well as in the work that I've done through the years, beyond, yes, mental health direct one-to-one services and case management, which has been very helpful in navigating systems, and we'll talk about housing later, peer support has been profound and is really helpful, especially if you're, say, on a waiting list, say, for one-to-one mental health services. That's fine. Community peer support can really have massive impacts on mental health, especially for our community that feels so isolated and persecuted by our society. To find community, as we say, the chosen family, is very, very important. So maybe looking into some of those pieces.
There was a question there, I believe. Did you want a response or not?
I wasn't sure whether it's a question for me or whether it's a question for Toronto Public Health.
I'll say that the Thrive report, the data that was used there was at the city level or even city census area level, so did not include by neighborhood. Certainly Toronto Public Health, wherever we do have sub-Toronto level data, our aim is to provide that information, because we know how important neighborhood level information is to our community partners, to where that is available. I don't believe that a geographical mapping of services is part of that, but certainly there is a sub-working group of Thrive that is looking at 2S LGBTQ plus mental health in follow-up to this report card, and we can bring that back to that working group as an area to, something that they might be able to tackle.
Okay, great, thank you. Any other questions? Go ahead, Maisha.
Thank you, and thanks for the presentation. I just wanted to quickly hit 2 points and just to respond to the question about what opportunities you can still partake in. One thing I would really recommend is connecting with more grassroots groups and also finding a way to connect larger organizations to grassroots groups. A lot of smaller grassroots groups in the city are actually getting a large population of people coming in from different intersections and identities. And I think there's a lot of untapped relationship building potential there to kind of maybe fill in the pieces for some of the data that you might not have really solidly been able to find yet. So I would really recommend that. The second thing is I really want to vouch again for 2S LGBTQ neurodivergent folks. Last year, through my work at supporting our youth, we did an asset map and a report on what services, specifically free services, are available downtown east for 2S LGBTQ folks between 14 to 29. And we found that there were no free support services or programs or curriculum programs available at all. There's a handful of maybe 6 or 7 counseling and like maybe university programs that folks can access. But again, those are not specifically just for 2S LGBTQ folks. And I think like we are, like I'm quite aware, and a lot of people are quite aware of what a lack of access 2S LGBTQ folks have in general, but specifically the neurodivergent population. There's such a big group of neurodivergent folks, specifically in the queer and trans community, and they just have very little or zero access to spaces that are specifically built for them. NeuroQueer was built last year as a pilot program that ran very successfully to kind of try and fill in, or start to try and fill in, that gap of no free services being available. But I just want to voice that there is a big need and a huge gap for specifically queer and trans folks who are on the spectrum, who have ADHD, just various types of neurodivergencies that, yeah, they're just not well represented. And the impact of that obviously on mental health is really devastating, because people who are youth will have no access to services, and then they become queer and trans adults who continue to not have access to supports. And I think I just want to echo Terrence's point on peer support sessions as well. We're finding that peer support spaces are really having a positive impact on folks as they're especially waiting with the long wait times that you mentioned in the mental health system. So yeah, finding more ways to fund and support groups for peer support services, having more research put into the importance of peer support services, and then, yeah, trying to find opportunities to tackle the lack of free spaces. As you mentioned, like finances are a huge strain on folks, and some of the programs that we found available to 2S LGBTQ folks are not free. So I think people are really needing, yeah, some of those services increased and more data and funding put into those areas. Thank you.
Okay, thank you. Taline, go ahead.
Thank you for the presentation. I just had a quick thing to share, kind of jumping off of Maisha's point with regard to the youth to adults sort of growth trajectory. What I've noticed in my time working with like queer and trans youth in Toronto is that there are or tend to be a lot of supports and access and opportunities available for youth. But once you hit 29, all of those supports tend to go away. So I would just want to look at the impact on mental health for folks who age out of programs and services and see what kind of information comes there. Because from my own anecdotal experience, it does seem to really impact the communities that I've been a part of. Yeah, thanks.
It's an interesting point that when maybe 10, 15 years ago, people were worried about transitions. And at that time, they were worried about transitions. And so they're worried about people leaving children and youth services at the age of 19 and going into adult services. And at that time, 90% of people were lost to follow-up when they moved from one group to the next group. So what people did in response is they changed the age at which people transition. So first it went to 25 and now it goes to 29. But it's not clear that we fixed the problem of transition. And so I would imagine when we look at the data that we'll find the same problem. It's just happening at 29 instead of happening at 19. So we still haven't fixed that problem, and I think it is really worth looking at. And thanks very much for bringing that up.
Thank you. Seeing no other questions, I'll just ask two quick questions. So what's unclear to me, though, is between 2015 and 2022, there was a 21% decrease in good mental health in the population. Do we know why there was such a steep decline? It was because, I'm assuming, probably COVID as a part of play?
Good question. There was a decline between 2015 and 2020 of about 8%. Then there was a decline in the first couple of years of COVID of about 10%. And then there was a decline after COVID as well, after the worst of COVID. So between end of 2021 going into 2023. So this is a trajectory which started before COVID, accelerated through COVID, and hasn't bounced back since COVID. So it's not just COVID.
Okay, thank you. And I mean, we know what the problems are, but maybe we can talk about some of the solutions. And Dr. Murdy, maybe talk about the food program, public health, maybe the TOUGH program where we're supporting different organizations in the community. Go ahead, I'll leave it up to you.
Yeah, thank you for that. I think we do need to be solution focused. I mean, there are a number of challenges that's been raised by the report, as well as all the questions here in terms of how we can best support across the different needs and the different intersectionalities of individuals where we're having that. You know, I think certainly at the upstream level where our work has been focused is at the child and youth and sort of setting a better trajectory, just because we've seen that has been one of the major impact areas and where we do have a natural connection and presence within schools, as well as working with school boards. But certainly, you know, as supporting other organizations moving forward to that, you know, one of our main mechanisms is through the Toronto Urban Health Fund, which has primarily focused on HIV as well as harm reduction and child and family services. And so a number of areas there, looking forward to being able to support you know, agencies like the 519, where just recently has been awarded a TOUGH grant. But I think that there's lots of areas where we're supporting the connections at that intersection of what needs to happen at the community level. And I think we heard from the speakers that the importance of places like peer supports, really more of that community-based non-health service connection, but also that health service connection. And I think that's one of the real benefits of being part of something like Thrive, is that there's things that we are working on at Toronto Public Health at the community level, but we also need those better connections to health services through our mental health partners.
Okay, thank you. Any speakers on the item? Susan Kaplan?
I'm still Susan. I have a motion that has been drafted with the clerk, so it should meet the standard that the two, I'm checking with the chair to.
It's being displayed. One moment.
Okay. Checking with the clerk and the chair to follow procedure.
Once it comes on the screen, you can speak to it. Go ahead.
That, thank you, Chair. That the Two-Spirit, Lesbian, Gay, Bisexual, Transgender, and Queer Advisory Committee requests the manager, Gender Equity, Social Development, to request, there's a couple of requests in there, to request the Medical Officer of Health to provide an update on Thrive Toronto Mental Health Report Card and the Toronto Public Health Action on 2S LGBTQ mental health in the new term of council. May I motivate?
Okay, thank you.
Or what's the procedure?
Yep, that's it. Do you want to continue speaking to it?
I just want to say that this is really personal for me. As a person who was on the streets or in and out of shelters and institutions for a decade, almost 3 decades ago, that housing is really important. I saw a touch on that. I'll speak to that next item. Employment equity is really important, but I also wanted to touch on what some of the other members said about how even I'm a little blessed that as a Canadian citizen, I've gotten access to services perhaps more easily, but racialized and Indigenous people are still, don't have the same success opportunities that someone like myself would have as a white person. So I just wanted to acknowledge that. Hopefully you can come back with some more, fill the gaps and come back and report in the next term of council, because I think this is really important that we try to be strong in our mental health and that diversity is our strength here at the Toronto. Thank you.
Okay, thank you. Any other speakers on the item? Seeing none. Thank you so much, Dr. Murdy, Dr. McKenzie, for coming in today and sharing your knowledge and expertise with us on this very important issue.
Thank you for the opportunity. Thank you.
Thank you. And to your support and to your staff as well. I don't have your names in front of me. I'll have, okay. We're going to vote on the item. On the motion. Just going to display it. No worries. Notifying the team online. Okay, all those in favor? Opposed? Carried. And item passed. Thank you. The next item, back to the top of the agenda, item number 2. And for those that are online, please keep your cameras on. We are just at beer quorum. Item QS 11.2, initiatives to support 2SLGQ plus communities experiencing homelessness. We have a presentation from Monica Waldman, Project Director, Homelessness Initiatives and Prevention Services. Toronto Shelter and Support Services, Rebecca Hooten, Manages Sector Capacity Building, the 519, and Martha Singh Jennings, Director of Housing Advocacy and Support Services. And the 519 are here to give a presentation to the committee. That's a lot of titles and people. You're welcome.
All right, thank you. I'm just going to set up here. No pressure. Good morning, everyone. As mentioned, I'm Monica Waldman. I'm a project director with Toronto Shelter and Support Services, or TS3. You're going to see we love our acronyms in my division. Really excited to be here today, and more so excited to be joined by my colleagues at the 519. They will introduce themselves later, but it's Martha and Rebecca. And so today we're going to provide a brief overview of Toronto's shelter and overnight service system. We'll then share some updates on our work to better support 2S LGBTQ plus people experiencing homelessness. All right. So just a little bit about our vision. Oh no. Toronto's a city where homelessness is rare, brief, and non-recurring, and where people experiencing homelessness are supported using a housing-first approach. And our mission as Toronto's Shelter Service System Manager, we oversee and coordinate shelter and support services and outreach to connect people experiencing homelessness with housing. So in total, we oversee more than 100 shelter locations across the city, serving diverse populations with a wide range of needs. Okay. Let me go to the next slide. So here's one of our acronyms. This is, we have the city's Homelessness Services Capital Infrastructure Strategy, which we call HSIS. And we've been making significant investments to expand and modernize the shelter system with a plan to develop more than 20 new shelter sites across Toronto. Over the past year alone, 11 new shelter locations have already been announced across the city. And together, these sites represent approximately 1,060 beds, which is about 66% of all new capacity planned under the strategy. Our focus in 2026 is on advancing the design and construction of these first 11 sites and moving them closer to opening and delivering much needed capacity. And importantly, as these sites progress, future program models and populations served will be informed by comprehensive system-wide assessment of needs. And this will ensure that new shelters are aligned with the emerging demands, service gaps, and evolving priorities across the homelessness response system. So this is a map. All of the blue dots are current existing shelters, both our base and temporary shelters. And then the big red dots are the new sites that have already been, as I mentioned, they're in our portfolio now, and we're developing them. Okay. So now I'm going to turn to our work on supporting 2S LGBTQ+ communities within the shelter system. Okay. Oops, sorry. So I wanted to talk about the street needs assessment, which is a point-in-time survey that helps us to understand the experiences and needs of people experiencing homelessness in Toronto. The 2024 street needs assessment results show that the proportion of respondents identifying as 2S LGBTQ+ has doubled since 2021. We are seeing particularly high representation among youth and refugee claimants, and in fact, 30% of youth experiencing homelessness identify as 2S LGBTQ+, which reflects a continued overrepresentation. These findings reinforce the importance of targeted supports as well as broad solutions, such as improving housing affordability and income supports. Now, as we know, with a street needs assessment, there are barriers and there are reasons why people might choose not to self-identify due to safety issues and trust in terms of where is this data going to land and how is that going to impact my safety. We did try and come up with some other methodologies to kind of encourage getting a more accurate representation, but just also wanted to put that out there to the committee. Right. Sorry. Okay, so in terms of implementing 2S LGBTQ+ inclusive street needs assessment, since the 2S LGBTQ+ data was first introduced in the street needs assessment, improvements have been made in how and what we ask participants. So leading up to the 2021 and 2024 street needs assessments, we collaborated with Dr. Alex Abramovich on gender identity and sexual identity questions based on best practices. 2S LGBTQ+ specific training for street needs assessment 2024 included a webinar with Dr. Abramovich entitled Creating an LGBTQ2S Inclusive and Affirming Street Needs Assessment for participants involved in the street needs assessment. Staff conducting surveys were asked to read and show a list of response options so respondents could see themselves reflected in the questions asked. TSSS is working closely with Dr. Abramovich for the analysis of the 2024 2S LGBTQI+ street needs assessment results, which is still underway. So we are doing a deeper dive, and a report or a manuscript is due later this year. Okay. So this is how 2S LGBTQ+ inclusive data informs service delivery. So as mentioned, it shows an overrepresentation of 2S LGBTQ+ youth in the shelter system. And so some of the things that we have done include making 2S LGBTQ+ competency training mandatory for all shelter staff as required in Toronto Shelter Standards. And the Toronto Shelter Standards and Toronto Respite Standards have been updated to better support 2S LGBTQ+ individuals to help address systemic barriers related to discrimination and ensure improved equity. Informing our targets for housing outcomes available through the Priority Access to Housing and Supports, which we call PATHs, and Rapid Rehousing Initiative, with 2S LGBTQ+ people experiencing homelessness identified as a priority population for access to housing. Okay, so updating our shelter standards. So it really truly is the standard of expectation across all shelters. In adding and enhancing the standards, we are looking to improve the experiences of 2S LGBTQ+ clients across several areas. They include capacity building, policy development, basic needs, creating safer spaces for clients, client-focused 2S LGBTQ+ resources and supports, as well as collaboration with community partners. The Toronto Shelter Network and the 519 Community Centre are also leading a community of practice for shelter operators to support providers to implement the standards and cultivate safe environments for 2S LGBTQ+ clients, review policies, access, and other aspects of shelter services, and TSSS is supporting this initiative. They will talk about it in a minute. I'm not going to steal that thunder. Okay, so, oops, did I forget to turn that? So, you know, we're really not just about talking and doing some things that we could check off a list. We've made this a directive and standards, and through our quality assurance department, we will be going out to shelters to review how well they have implemented these changes. Yeah, exactly. Okay, where am I? Okay, so now I just want to talk about a new venture that is coming out. We've been working on this for a while and it's coming to fruition, which is a service user advisory group. And so this acronym is SWAG. Oh no. Okay, that was too much swag there. So TSSS is establishing a service user advisory group made up of people staying in shelters or experiencing homelessness. The SWAG will provide input and improve service delivery, policy, and program development. The Toronto Neighbourhood Group was selected in Q4 of 2025 to operate the SWAG. Membership will reflect Toronto's shelter population with strong 2S LGBTQ+ representation. And the SWAG, again, will help inform policies to improve experiences for 2S LGBTQ+ clients in the shelter system. Okay. And now I'm going to turn it over to my friends here. All right.
Hello. My name is Rebecca. Once again, I use she, her pronouns. I just want to say I'm especially happy to be here today because when I was a student starting at the 519, I actually was part of the team that led to the creation of this advisory group. We wrote the report, did the focus groups, and so this feels really special to be here. About this time, we gave the report to the city, and so 7 years later, this feels really special. Thanks so much for having us. So as you likely know, the 519 is a City of Toronto agency. We are the largest 2S LGBTQ serving organization in Canada, and we are celebrating our 50th anniversary this year. So 50 years of growing with the community and serving diverse 2S LGBTQ plus needs. In 2022, we received funding from the city to be able to offer sector-wide training to shelter staff. This built on advocacy that started decades ago. Many of you may have participated or know about this, the advocacy we've done, including the 2001 Trans Access Project and a 2002 community consultation requested by the city. The 2022 report showed a lot of what we've heard about today, the disparate need of specifically trans and non-binary communities, two-spirit communities, the fact that they were not feeling safe in shelters ongoingly to this day. And so we built this training. You can see here a little peek into the training itself, including your very own Susan Gafka on the screen here. And we have a wide variety of topics covered in this training. We realized that we needed to go beyond just 2S LGBTQ folks exist in your spaces, be nice, and really actually offer tangible tips and information to support frontline workers and people throughout shelter providers to be able to meet the needs of these communities. We talk about two-spirit experiences, the realities of queer and trans refugees and how they are advancing through the immigration system, trans-specific realities that shelter providers need to be aware of, and also speaking to the history of harm reduction and how it relates to queer and trans advocacy and how that shows up today as well. And so there's a lot of depth in the training, but it also, as you'll see here, this is a quote from someone who has done the training. We have heard over the past few years a lot of really positive feedback, that this meets learners where they're at, that it is practical, that they're getting tools, and that it is offered in a relatable and conversational tone rather than prescriptive. We want to make sure that we are engaging with folks who we know have so much on their plate and that they're able to really dig into this training and see how it relates to their work. So some details. The training itself is a mix of asynchronous and synchronous learning. So we have 11 virtual modules that we collaborated with 12 519 staff, 2 community members, and 3 collaborators from other agencies, so totaling 17 different people of different backgrounds, ages, genders, experiences, to speak to all of these diverse perspectives and the learning pieces comprised in the asynchronous learning. We also have really put an effort into making sure that it's accessible for people of different learning needs. So there's text-based learning, there's subtitles on all the videos, it is spoken aloud, and we also have the live component where people are able to integrate their learning. So the asynchronous pieces can be done at folks' own pace, and then there are 2 live Zoom sessions facilitated by someone from our team where people can ask questions, they can dig deeper into the material that they will have learned in the videos, and we also facilitate scenarios, which we'll get to in the next slide, but we won't go there yet. This, as mentioned, was funded by TSSS and has been mandated for city shelter staff, and so this has been a real positive in terms of making sure we get all of the learners across the city trained. We've actually worked with 13 other agencies outside of the directly operated shelters through the city, which accounts for almost around 1,500 staff so far, and the numbers are growing and building as we have, reached more providers and they now know what we're about. And this accounts for about 10,000 training hours, so that feels really exciting, and we are going to continue on that path. The feedback, as you'll see here, we have basically a 97% of well-received, would recommend stars, and really the qualitative data that we get back is just people saying how much they feel, how much more ready they feel to support 2S LGBTQ folks across the identity spectrum within our communities. And so that's been incredibly exciting. Let's take us to our next slide here. This is another little look into the training itself. These are our scenario characters. We built these characters from the lived experiences of people who come through the 519. Obviously, folks who are going to shelters, they hope to have community, and we aim to create that community. And so they come to us as well, and we hear about their experiences in these spaces, good and bad, and the life experiences that led them to that point. And so obviously these are not real people, but they are an amalgamation of real people that we do know their real experiences, both before ending up in a shelter and what happens in those shelter spaces. And so we invite learners to connect deeper with the characters and then figure out what they would do in specific scenarios that show up in the trainings, and we debrief those in the live sessions that we do via Zoom. It's been wonderful. People have had robust conversations, and we will continue to offer this and continue to expand the training as well, offering more resources, making it even more accessible, and keeping up with current issues and current realities to make sure that it's applicable each year to what is happening in the world. I'll pass it over to my colleague, Martha.
Hi, everyone. My name is Martha Singh Jennings, and I use they, them, and she, her pronouns. As previously mentioned by Monica, this team is also doing some really interesting other forms of engagement within the shelter sector in the form of our recently launched community of practice. The intention of this space is to gather together leaders from the shelter sector to create consistent, dignified and service delivery for 2S LGBTQ plus shelter residents across the whole of the city. We're really wanting to make sure we're coming to this in a really practical way. So we're offering opportunities to approach and reflect upon the new updates to shelter standards and how we might go about implementing those effectively, impactfully, to better support queer and trans folks. And there's a focus on compliance in terms of policy and practice, and really tangible supports and resources so that we can hopefully get folks feeling ready for the quality assurance process that will be coming in the next year or so, and also feeling good about their engagement in the space and intentions around implementing these updates. There's been a really there's been an intention from us to avoid the tokenization of two-spirit queer and trans folks. It often happens. So we've been very explicit with the sector that this space is not explicitly for queer and trans people. If queer and trans people happen to be leaders in their organizations, then for sure send those folks along. But the intention of the space is for it to be participated in by people who are power holders and have positions to change culture and shift thinking within their organizations. At the moment, this cohort that we're supporting in the community of practice, we've really modelled the structure against the updates. Although we expect this will be kind of like an iterative process as we go through and we work with providers to see what they need. But right now, we're as I said, we're modelling it after the Toronto Shelter Standards updates that came out in December, and so we have 2 themes with sessions on specific topics within those themes. So the 2 themes themes that we're working with right now are cultivating safe environments for 2S LGBTQ plus shelter residents and 2S LGBTQ plus policy development and alignment. And then within each of the sessions, we dig more deeply into specific conversations with the intention of identifying gaps and needs and therefore leading towards the potential development of resources and supports by us and ground sourced from within the sector, and hopefully also allowing people to spotlight the great work that they're already doing within their organizations. As I said, it's iterative, so you'll see session 3 here, 2S LGBTQ plus health supports. That was actually added after our first session, inclusive programming, because the folks participating really wanted to learn more and dig deeper into that. We actually have that session this afternoon, so we'll likely be rushing off after we speak with you to go and deliver that. And we're really happy to be doing this work in collaboration with many. As Monica mentioned, T3S are working with us, and Monica and Lauren, our colleague here, are regular attendees and supporters of this work, and we're really grateful for that. We're also co-hosting this space with Toronto Shelter Network, and in order, as with our training, to ensure that we're including diverse voices in the planning, and also to ensure that we're coming at this from a really real, on the ground, what is happening, what is practical perspective, we have gathered an advisory committee. And this committee is made up of people who are 2S LGBTQ themselves and who currently work in or have historically worked in the sector and are still adjacent to it. And this group meets once a quarter to plan what the sessions are going to be, help to develop agendas, exercises, and resources for the space. And we're very happy that this group includes Toronto Drop-In Network, Friends of Ruby, Two-Spirit of First Nations, Salvation Army, Dixon Hall, YMCA Greater Toronto, EVA's, Fife House, and also Homes First in relation particularly to Pacewood, which is the collaboration we have with Homes First Society around the operation of the city's only adult shelter space for queer and trans folks, which is specifically for refugee newcomers. I also want to take this wonderful opportunity that we have today to highlight some of the other housing and homelessness related work that the 519 is doing, namely advocacy. So as we've already discussed here today, and I'm sure many of you are well aware, queer and trans people are significantly overrepresented in experiences of being unhoused, precariously housed, and experiencing discrimination within their housing journeys, from youth shelters all the way up to long-term care homes. This is a huge and growing issue. Our communities are disproportionately impacted by the national housing crisis, and that is something that at the 519 we cannot ignore. And building on many years of work, as Rebecca previously mentioned, of both 519 and its staff members and also community advocates, we have recently published a new report. I have some hard copies here for folks in the room, and we can also certainly send out PDF copies to those who are interested online. This is hot off the press. I got these on Monday. And so we're going to be circulating and sharing this broadly with city councillors and staff, and look forward to welcoming conversations with the city about how we can continue to collaborate on effective responses to address the huge, diverse, and very concerning housing needs of queer and trans community. Within the report, you will see that the voices of many are represented, including community members from our Meal Trans, Trans Youth Mentorship, Trans People of Colour, newcomer programs, and residents of Pacewood. We have been doing, over the last many decades, and in the last few years certainly, many community consultations, and also build on the work of community consultations and research projects led by many others in this report. And we want to see, as you'll see from our recommendations, specific housing and shelter and housing support services for queer and trans people, for 2S LGBTQ plus people. We want 2S LGBTQ plus people at decision-making tables in relation to housing. And we all need queer and trans, Two-Spirit, and all equity-owed communities need protections across the system in relation to renters' rights and to stop the financialisation of housing. And we would love to come back and speak to this committee in future about this report in more detail and give you any updates we might have about it going forward. Thank you.
Thank you for that great presentation.
I have just a couple potential discussion questions. We don't have to land on this, but I did prepare that in case. So yeah, so based on the updates shared today, does this work resonate? Are there any areas you would recommend we focus on more closely? I think this hot off the press or not press report will probably have some of that. And are there any opportunities of connection and learning that TSSS can draw from across other city initiatives to support 2S LGBTQ plus populations? Okay, that's officially my end. Thank you so much for having us, and yeah, looking forward to your questions.
Thank you, great presentation. If you unplug your device, then I could see my colleagues online. You lost Corey? Okay, we're just at quorum. So all the members that are online needs to actually keep the cameras on and please don't log off. Otherwise, we cannot proceed with this meeting. Questions of presenters? Go ahead, Terrence, and then Rajit, and then Susan. Go ahead.
Thank you, and thank you for the presentation. Very detailed, and I'm sure you're going to get a lot of questions and feedbacks from the community as we're very passionate about this. So I do have a few questions. Hopefully you take some notes. And it's a fair amount, so I don't know if you're going to be able to hit them all. So how are new locations being opened and identified? I noticed some gaps on the map that you were showing in regards to the geographical map and the dotting system. So that was question number one. When developing these locations, are individual spaces being considered and developed for trans and non-binary folks? For example, are there like individual, like, say you have shared accommodations, are there individual accommodations being created as well for safety reasons? And in line with that, also looking at washrooms, right? So in creating gender-free washrooms in those spaces, I was wondering if maybe, as I was looking at the presentation too, and that mapping especially, if some like dashboard can be created or some interactive mapping, because I really wanted to like hover on that PDF document, hover with some of those dots and get some more details on that, but I couldn't to see what you had found, or maybe zoom in to see specifically what that intersection is or something. So I don't know if that has been created, can be created, in the works being created, but maybe a recommendation too, some kind of like dashboard that can be showing some of this information and continuing to update on it. And you mentioned some training that you've done. Have there been any procedures put in place for the service users or the staff to report on non-inclusive practices? So, trainings are great, but then what happens then? Are there anything put into place, whether internally within an organization or the partners or within the partnerships, or even just, whatever, maybe it's external whistleblower, but something put in place so that there can be a follow-up that great training's done, but now when folks aren't practicing what they've been trained, how do we hold them accountable, or how do we adjust these spaces then in those follow-up pieces? And then can we make future partnership agreements with local organizations contingent on an assessment of the organization and if they have inclusive services themselves? I'll speak more to this later in regards to some of the experiences, but I'm weary on the partnerships that are being developed or will be developed and whether or not they are actually inclusive to our community. So it's great that you have maybe, say, a geographical partner or the area that you want to work in, but do they have that same lens that you have, or do have the same practices? Because if you actually look more deeper into regards to the organization, you may find that they're not, and that could really feed into whether or not the actual space is inclusive, because you may help set it up, but who runs it, who represents it and all that jazz. And last question, sorry, I said a lot. Are there any processes to follow up and address any of the emerging needs from the community as they engage with housing in the shelter system. So, maybe it's the space doesn't work for them, or the location, or they are in a space where their neighbor isn't inclusive, or they're facing some experience of homophobia or transphobia. So something where there can be a follow-up and maybe pivot as needed if there's any emerging issues that arise. Because once you're situated, you shouldn't have to be cemented in a space. If it's not working for you, you don't feel safe.
I am, I'm going to try but feel free to, sorry, through the chair, if I don't remember some of the questions, can I refer back? Because I know the clock is ticking. Okay, so first off, we do not have an interactive map, but I'm going to take that back because that's a good idea. I mean, you can, if you see it on your screen, you can probably enhance it. And we do have a list of the 11 new sites and where those locations are that are coming through the capital infrastructure strategy. In terms of creating space, I think we all know that hanging up a pride flag does not equate to a safe space. We have something called the Shelter Design Guidelines, and that there has been consultations to develop that, to look at best practices for, new builds or renovations. I think we're much more likely to do that in these new situations, and it's probably some of the older existing infrastructure that needs some reworking to make the physical, design more inclusive. But so yes, that is part of it. I think we can share that, or I believe that the design guidelines are, it's a public document. In terms of, so we've got 11 sites. We've got about 9 more to go. All of city, provided that they are, in zones that are not employment zones or like right in the middle of a residential area, are potential sites. So we recognize not every corner of Toronto has a shelter space, particularly, I would say, the northwest area. We're continuing to look for sites. As you can imagine, that it also comes with challenges in terms of, not every space across Toronto welcomes new shelters, and there are also processes that we have to go through with our facilities and real estate folks, because they have to, we have to follow city processes about negotiating either renting, leasing spaces or purchasing spaces. So I'm not sure if that answered, that's the best I can get at with that. In terms of where we go from here and where the gaps are, we know that the first 11 sites kind of out the gate are going to address some of the gaps, but definitely not all of the gaps. And we are continuing to look at what our data is telling us to inform future priorities. So we do have another street needs assessment. We have to do this annually. So we've got another one coming up in October of this year. And I think we can also look at if there's opportunities to make any refinements so that the street needs assessment can further enhance and inform our decision making. And sorry, through the speaker, I feel like I've missed a bunch.
Well,
and I'm over time.
Yes, I've given you a few extra minutes here. That's fine. Just for members beware that we may actually lose quorum at 12 noon, because we had quorum and one member actually has to leave at 12. So keep that in mind. Ranjit, go ahead.
Yeah, thank you so much. My question is regarding training, and I'm so delighted that you're doing training for shelters. With my long term work with LGBTQ plus refugees and newcomers, I know that some of the clients have faced violent forms of racism. they are violent. They were hospitalized because specifically anti-Black racism, specifically refugees and newcomers. So I just wonder whether you include these nuances of racism, especially facing Black, trans, queer, and racialized refugees and newcomers in the shelter systems, because that is something mainstream LGBTQ plus people may not face. If somebody is white, they don't face racism in this country, and I also have faced racism in mainstream LGBTQ plus communities. So these are very, very important for us to highlight. I just wonder whether your training program include that. Thank you.
Thank you for the question. Excellent point, absolutely. There's a whole module in the first half of the training about intersectionality and the importance of recognizing the impact of microaggressions and, of course, macroaggressions, but recognizing the spectrum of how these different types of forms of discrimination can show up, and naming each, that there are a plethora of ways that folks can experience discrimination, certainly naming racism, certainly naming anti-Black racism. One of our characters is a Black trans woman, and she has that sort of intersecting experience through the story that we learn of her and how she is treated in the shelter in the scenario sort of debrief piece. And so we really try to touch on the large spectrum of experiences, but that is absolutely a part of it, and in the refugee section as well, speaking to the unique experiences of refugees. So thank you for bringing that up.
Okay, thank you. Susan?
I'm concerned about time.
Yeah.
So I'm speaking as a community member on this committee. Susan Gapka, I'm a resident who's experienced a decade of homelessness on the streets of Toronto. I'm coming up to, on Sunday will be, but who's counting, 29 years, because I received the kind of services that you're trying to implement. So thank you for that. I had more to say on that, but I just made a note. I thought the street needs assessment was canceled. But that could have been a pandemic thing, so that is still a contentious issue about a moment in time counting people. But I remember when they first did it, before Alex became a doctor, that I go, you can't assess people on appearance. You've got to talk to them about who they are. And so I remember those days. I also remember when they didn't have these services, that the manager for shelter and services and housing asked, how long have you been trans? And so we've come a long ways. I want to note discharge planning is really, really important, and having wraparound services. That's not really a question, but I think I just wanted to really, the question was, does this resonate with us? And for me, you are the implementation gap from the previous presentation on what the research says and how we're connecting with communities. So I'm really just saying thank you for what you're doing, and I hope we get to hear from you again sometime after we read the report.
Okay, thank you. There was another question there. So any other questions? Seeing none. I had a few, but you know what? I will forego my questions because of interest of time. Speakers on the item? Okay. Susan, go ahead. You have a motion?
Working with the clerk, there is a motion that I don't have the printed copy, but will come on the screen.
Put it on the screen. You can speak to it once it comes up.
I will motivate, security wasn't as impressed with my key to the city as I hope you might be, but I'm going to read the motion as soon as it comes up and just give a...
You have a hard copy of the motion, right? Here it is. Here it is, okay.
Okay, thank
it's on
you.
The screen.
Oh, there it is.
It's on the screen, go ahead.
Thank you. We're just trying to get this in. So I move as a community member, that the Two-Spirit, Lesbian, Gay, Bisexual, Transgender, and Queer Advisory Committee requests the Manager of Equity, Gender Equity, Social Development to request the Project Director, Homelessness Initiatives and Prevention Services to provide an update on initiatives to support the 2S LGBTQ plus communities experiencing homelessness in the New Terma Council. And that's the motion. And I want to know how you're doing, and I think it's really important work, and I want it to continue to be coming to this committee for feedback, comment, and to so that others will have the same opportunities that I had. Thank you.
Okay, thank you. I'll just say quickly that thank you for the presentation and all the hard work you're doing on this. I really do like the competency training for staff that's in place. It seems to be going well. Though you're focusing on TSSS, I do hope perhaps you look at other city divisions, for example, Parks and Recs, right, which is really an important agency in the city. So there's value there in actually spreading the good news. The one thing I was going to ask about, but I'll just mention here, is the SWAG advisory group that you're looking at, Service User Advisory Group. Again, I'm always reluctant to have more advisory committees in the city because there's so many already, and it's the same people going to different advisory groups. And people are at capacity as well, and then people lose interest as a result of that because they feel that, not enough is being done. I know we have an advisory committee at the city for housing specifically, so I'm curious to know why there's a difference, but I understand it, but I don't understand it. But anyways, I'll just leave that there, but I look forward to learning more about it and seeing how useful it is, and if it needs tweaking when it comes into being, perhaps we could actually make some adjustments if needed. And again, Susan's motion, you'll come back to after next year and perhaps give us some more updates as to where we're at. With that, I'll ask that the motion be put on the screen. Okay, all those in favor? Opposed? Then that's carried. Thank you so much. The next item is QS 11.3, Focus Toronto and WomanACT pilot. And the presenters here is David Absalom, manager, and Matthew Carroll, supervisor from Community Safety and Wellbeing, Social Development, and are here to give a presentation to the committee. So coming up. Okay.
Thank you, Chair, and good morning. Also, almost afternoon, committee. So my name is David Absalom. I am the acting manager of SafeGeo and the Community Risk Intervention team. I'm joined here by Matthew Carroll, supervisor of Community Risk Intervention. Today, we're here to provide an overview of an upcoming Focus Toronto and WomanACT pilot, which is intended to strengthen coordinated responses to intimate partner violence and support community safety and well-being across the city. So before we get into the pilot, we want to provide a brief overview of Toronto's community safety and well-being plan. So SafeGeo was developed in response to the provincial requirements for municipalities to create community safety and well-being plans. Our well-being plan is a comprehensive 10-year community safety well-being plan that reimagines core elements of community safety and well-being in order to shift our paradigm from a reliance of reactive emergency response to a culture of proactive prevention. So SafeTO includes 26 actions across 7 strategic goals. The goals reflect the broad and interconnectedness of community safety and well-being, including reducing vulnerability, reducing violence, advancing truth and reconciliation, promoting healing and justice, investing in people and neighborhoods, and driving collaboration and accountability. The plan itself provides a roadmap for how the city and systems that serve residents, such as community services, healthcare systems, businesses, education systems, justice systems, and emergency services can work collaboratively across different sectors and across governments to support community safety and well-being. So this slide here provides a overall timeline when it comes to SafeTO. So in 2019, we have the inception of the plan as mandated by the province. In 2021, SafeTO was unanimously adopted by City Council as Toronto's 10-year community safety and well-being plan. In 2022, Council adopted SafeTO's Phase 1 key actions and deliverables. This focused implementation really worked on 4 key priority actions that were within the broader SafeTO plan. In 2025, Phase 1 key actions and outcomes were reported back to City Council, along with Phase 2 key actions deliverables being adopted by Council. Looking ahead, Phase 2 outcomes and priority actions will be reported back to Council in 2027, and in 2031 will bring us to the end of the 10-year plan. So for Phase 2, SafeTO is really prioritizing 4 actions that respond to the emerging needs identified through council direction and community advocacy. First is Action 2.2, developing a comprehensive gender-based and intimate partner violence reduction plan. This plan, or this pilot that we're discussing today, falls under this action. The second is Action 3.2, developing an implementation plan to guide the city's response to the calls for justice from the National Inquiry into Missing and Murdered Indigenous Women and Girls. The third action is 5.1, engaging residents and building community capacity to lead. So this is really about communities having a more active role in safety planning and implementation. Then for the fourth action, we have 7.3, strengthening multi-sector collaboration through partnership and integrated investments. So this is about improving coordination across systems and responding to emerging needs through more integrated place-based approaches. I'll now turn it over to my colleague Matthew, who will provide a little bit more detail about Focus Toronto and the WomanACT pilot.
All right, thank you. And greetings to the committee and to the chair. My name is, as mentioned, Matthew Carroll. My pronouns are he and him. I am the supervisor of community risk intervention, which includes the portfolio of Focus Toronto and STAR. I'm here to introduce, as David mentioned, the intimate partner violence pilot supported by WomanACT, one of our partners, and the City of Toronto, with 2 of our Focus Toronto situation tables. To note, FOCUS stands for Furthering Our Community by Uniting Services Toronto, and there will be an opportunity at the end of the presentation to obviously provide feedback as we appreciate your perspectives and expertise. So Focus Toronto is a collaboration of more than 190 community agencies across the City of Toronto. The initiative is led through a cross-sector partnership between the City of Toronto Social Development Division, specifically Community Safety and Wellbeing, Toronto Police Service, their Community Engagement section, and United Way. Focus Toronto launched Ontario's first situation table in Rexdale in 2013, and since then the model has expanded to 7 geographic-based situation tables covering the entirety of the city. At its core, Focus Toronto brings together the most appropriate agencies on a weekly basis to coordinate rapid, wraparound interventions for individuals, families, and households experiencing acutely elevated risk. We also refer to this as just simply AER. What that means is these are situations where there is significant likelihood of harm, victimization, criminalization, or escalating crisis if immediate intervention does not occur. Importantly, the model is not intended as routine case management, so it does not duplicate regular service delivery, and it's not also for investigative purposes. It is a short-term, risk-driven intervention approach designed to mobilize the right supports quickly, often within 24 to 48 hours. Also, importantly, privacy is foundational in our work at Focus Toronto. Situation tables are governed and informed by the Ontario Privacy Legislation Commission, and guidance from the Information and Privacy Commission guides our work on a daily basis. The process is grounded in the principles of necessity, proportionality, and the least intrusive intervention. Information is only shared when there is a significant risk of harm that cannot reasonably be addressed by a single organization alone, and in a way we provide de-identified information that's banded during that process. So for example, Focus Toronto would not collect the age 25, if you will. If we have a service user at the table, we would collect the banded category of an individual at the table that's 20 to 29, as an example. So just to break this down kind of in a four-filter process is what we would call it. This filter one is the first screening stage of where the originating agency determines whether the situation may meet acutely elevated risk. And so an organization and community, they see an individual that they're concerned about, they would then potentially identify that this individual is experiencing acutely elevated risk and then present it at the table. So this presentation is where filter two comes in. It's a de-identified discussion. No names or identifying information are shared at this stage of the table process. Partners assess whether the situation truly meets that threshold for coordinated intervention, and then will vote if it is truly in fact AER. This is then preceded by stage three, where there is limited identifying information shared, but only with the agencies that have a direct role in reducing risk. So City of Toronto and Toronto Police co-chairs do not sit in that huddle where information is being shared about an individual in that space. Filter four focuses on intervention planning, where the relevant partners coordinate a timely targeted response focused on stabilization, support, and risk reduction. Following the intervention, there is a report back process where limited updates are provided regarding whether contact occurred with the individual, whether risk was mitigated, and whether the situation can be closed at the table, while continuing to respect privacy and consent principles through the process. So, building on this framework, Focus is now adapting the Multi-Agency Risk Assessment Conference, or simply known as MERIC. MERIC is a model that is going to be used in the IPV pilot with the support with the leadership of WomanACT and its partners at Focus Toronto. This work draws on promising practices from Grey Bruce, Perth, Alberta, and other jurisdictions in Canada and around the world that strengthen structured risk assessment for survivor-centered planning, multi-agency coordination in intimate partner violence situations. Two specialist organizations, the Redwood Shelter and Ernestine's Women's Shelter, were selected through a competitive process by WomanACT to support implementation at the Rexdale and York situation tables. The pilot is focused on advancing several key outcomes, including enhanced IPV risk assessment tools, standardized coordination processes, improved referral pathways, and IPV-related data collection that is aligned with our process at situation tables where appropriate. It also creates an opportunity at Focus Toronto to deepen collaboration with community partners that will provide strengthened, coordinated, trauma-informed responses to individuals experiencing intimate partner violence, including members of the 2S LGBTQ community. Ultimately, the goal of the pilot is to reduce acutely elevated risk through earlier, more coordinated, and more survivor-centered intervention across systems and sectors. So you'll see in that final box on the right-hand side, the identified outcomes and deliverables. These include risk assessment tools and training for high-risk IPV situations. We actually have a training upcoming soon that we'll be providing back to our partners at Focus Toronto. Standardized IPV case management process at the Rexdale and York situation tables. Opportunities to enhance IPV-related data collection while respecting applicable legislation. Enhanced referral pathway designed to support quicker access to services and interventions where possible, and decision-making informed by community partner engagement and learnings gathered throughout the pilot. So, Key partners, as mentioned, the City of Toronto is leading this work with WomanACT, Toronto Police Service as part of the partnership of Focus Toronto, United Way, our 190, almost 200 agencies and community that are partners at the table, and our GBV and IPV community working group that helped assemble the model. So the Merrick pilot at Focus Toronto is going to be led through WomanACT, receiving funding through WAGE, which is Women and Gender Equality Canada, for the pilot. And WomanACT is planning and policy organization focused on ending gender-based violence and advancing gender equity. Their work includes research, policy development, education, advocacy, leadership, and community mobilization to support system-level change. The two pilots as partners, as discussed, the Red Door Shelter, they provide emergency shelter for support for women and children fleeing domestic violence, families experiencing homelessness, refugee claimants, and their services include safe refuge, crisis counseling, legal and immigration assistance, medical referrals, child and youth supports, case management, housing supports, and settlement assistance. Ernestine's, our second partner, provides emergency shelter and wraparound for women, children, and gender diverse people fleeing violence. Their services include counseling, safety planning, legal, housing, and immigration supports, child and youth programming, and outreach services for community. In terms of our timelines, the pilot began with the selection committee and proposal phase between November 2025 and January 2026, followed by training and capacity building from February, which will continue now into June. As mentioned, we're going to be doing training on risk assessment tools and building the confidence of our partners at the table to identify IPV-related cases sooner. And the pilot implementation will officially, or has officially launched alongside the year one progress report. Full implementation then continues from May, as of now, through March 2027 across the identified tables, York and Rexdale. And as the pilot progresses, year two focuses on ongoing evaluation, learning, and continuous improvement supported through quarterly updates and ongoing engagement with community partners to inform future decision-making and sustainability of the model. I want to draw your attention to some just quick statistics. So we wanted to show the committee that the pilot site selection was not based on one factor alone. First, WomanACT and Focus Toronto reviewed TPS open data on reported IPV rates per 100,000 folks, alongside Focus Toronto domestic violence study flag, which is a flag that we identify when situations come into the table. This helped us understand where IPV-related risk was appearing both in police-reported data and within situations being brought to the Focus Toronto tables. Second, we consulted with Focus Toronto leads to understand the local context behind the numbers. This included the complexity of situations at the tables, such as housing instability, maybe, for example, a lack of resources in an identified geographic area, mental health services, substance use, child and family safety concerns, immigration or settlement issues, social isolation, and repeat of escalating risk. And then third, we also considered existing community resources and system capacity. So Rexdale and York were identified as sites where Merrick-informed enhancements could strengthen coordination, improve referral pathways, and support more timely responses to high-risk IPV situations due to the nature of the data that was presented and also due to the lack of resources to respond to the risks presented to the table. Here's another map that just is essentially color-coded of the same bar graph. And really, this slide just highlights in a map graph style how the pilot sites were selected through a comparative analysis of TPS and Focus Toronto data. Focus Toronto's tables are aligned to TPS divisions in terms of catchment. So for example, if you see in the Scarborough area, right, you have those 3 TPS divisions, that's one table. So that's the Scarborough situation table. So by mapping reported IPV rates alongside Focus Toronto, York, and Rexdale, they emerged as key areas for the pilot due to higher rates of IPV and identified community need. The selection process also considered system complexity as discussed, existing community resources, and local service coordination as mentioned. So, thank you for letting us present first, and we're excited to support our community, including WomanACT in their leadership and Red Door and Ernestine's with their partnership at Focus Toronto, including our 190 partners that support this work to date. At this time, we want to turn it back to the committee and invite your feedback on the following discussion questions posted. So 1, are there any partners not currently listed that should be engaged? 2, do you have any feedback on the emerging directions or anything else presented today? And 3, from your perspective, what considerations should be made in the implementation or evaluation of this pilot as it emerges through its progression?
Thank you, David. Thank you, Matthew. Great presentation. Unfortunately, we've lost quorum. So we cannot ask questions of staff or speak to the item, nor can we receive it. So we'll have to defer this item to our next meeting in July. You will not have to present again, but you may have to come back, questions of the members here. And we'll have to defer item 5 as well. So yeah, my apologies to you and to the members. I'm going to have staff do a roll call. We actually have sent out 2 emails to members to see if we can get people back online, but no one has responded. So I'll have staff go ahead and do a roll call.
Members, it's now 12:11 a.m. and members present in the meeting: Chair Moyes, Vice Chair Susan Gapka, Maisha Zarin, Pink Angel, Ranjith Kulatilaki, and Terrence Rodriguez, and Cooper. Members not present in the meeting: Dr. Jad Jabber, Leila Shahid, Talene Wright, Micah Chu, Philip Del Campo Donaso, Leslie Lee Cam, Lauren Craig. Members, we do not have quorum. The meeting cannot proceed. And as the chair mentioned, all items will be carried over to the next meeting of the committee on July 7th, 2026.
Thank you to members who remained. Very much appreciated. It was actually a really great meeting with a lot of important items on the agenda. So, and thank you for your participation, which is always very much appreciated. We'll see you in July.